Codeine is an opioid medication that is commonly used for pain relief and cough suppression. Its pharmacology involves several key aspects. 1. Opioid receptor agonist. Codeine acts as a partial agonist at the mu-opioid receptors in the central nervous system. Mu-opioid receptors are primarily responsible for mediating the analgesic pain, relieving effects of opioids. 2. Metabolism. Codeine is metabolized in the liver by an enzyme called CYP6 into its active form. Morphine. Morphine is responsible for much of codeine's analgesic properties. 3. Analgesic effect. The primary therapeutic effect of codeine is pain relief. It binds to mu-opioid receptors in the brain and spinal cord, reducing the perception of pain. 4. Cough suppression. Codeine is also used as an antitussive cough suppressant. It affects the cough reflex in the brainstem, reducing the urge to cough. 5. Combination products. Codeine is often combined with other medications, such as acetaminophen or ibuprofen, to enhance its pain-relieving effects. These combination products have their own pharmacological profiles and considerations. Pain relief. The typical adult dose for pain relief with codeine alone is usually 15 to 60 milligrams mg, every 4 to 6 hours as needed. However, the specific dose can vary based on the severity of pain. Cough suppression. When codeine is used as a cough suppressant, the usual adult dose is 10 to 20 milligrams every 4 to 6 hours as needed. It's important to use codeine-containing cough medications only for a short duration as directed by a healthcare provider. Maximum daily limit. Generally, the maximum daily dosage of codeine should not exceed 360 milligrams for adults. Exceeding this limit can increase the risk of side effects and dependence. Codeine, like other opioid medications, can cause a range of side effects. It's important to be aware of these potential side effects and to use codeine only as directed by a healthcare professional. Common side effects of codeine may include 1. Drowsiness. One of the most common side effects of codeine is drowsiness or sedation. It can impair your ability to drive or operate machinery safely. 2. Constipation. Codeine can slow down bowel movements, leading to constipation. Staying hydrated and incorporating fiber into your diet can help mitigate this side effect. 3. Nausea and vomiting. Some individuals may experience nausea and vomiting when taking codeine. This side effect can often be managed by taking codeine with food or as directed by a healthcare provider. 4. Dizziness. Codeine can cause dizziness or lightheadedness, especially when getting up from a sitting or lying position. It's important to move slowly to minimize this side effect. 5. Dry mouth. Codeine can lead to dry mouth, which can be uncomfortable. Staying hydrated and using sugar-free gum or lozenges may help alleviate this symptom. 6. Itching. Some people may experience itching or skin rashes while taking codeine. If severe or persistent, it should be reported to a healthcare provider. 7. Sweating. Codeine can cause excessive sweating in some individuals. 8. Respiratory depression. Although less common at therapeutic doses, codeine can suppress breathing, especially when taken in high amounts or combined with other respiratory depressants. It's essential to use codeine only as prescribed. 9. Mood changes. Opioid medications like codeine can affect mood, leading to feelings of euphoria or, conversely, dysphoria in some individuals. 10. Tolerance and dependence. Prolonged use of codeine can lead to the development of tolerance, where higher doses are needed for the same effect, and physical dependence, which can result in withdrawal symptoms when the medication is discontinued. 11. Serious allergic reactions. Although rare, codeine can cause severe allergic reactions characterized by symptoms like skin rash, itching, swelling, severe dizziness, and difficulty breathing. Seek immediate medical attention if you experience these symptoms. Codeine can interact with various medications and substances, which can lead to potentially harmful effects or reduce the effectiveness of codeine. Here are some of the most common interactions to be aware of. 1. Other opioid medications. Combining codeine with other opioids, such as oxycodone or morphine, can increase the risk of overdose, respiratory depression, and other serious side effects. 2. Alcohol. Drinking alcohol while taking codeine can enhance its sedative effects and increase the risk of respiratory depression. It's essential to avoid alcohol when using codeine. 3. Sedatives and CNS depressants. Medications like benzodiazepines, e.g. diazepam, or other central nervous system CNS depressants, e.g. sleep medications, can potentiate the sedative and respiratory depressant effects of codeine. Combining these substances can be dangerous. 4. Monoamine oxidase inhibitors, MAOs. MAOs are a class of antidepressant medications. Combining codeine with MAOs can lead to a potentially life-threatening condition called serotonin syndrome, characterized by symptoms like fever, confusion, rapid heart rate, and muscle stiffness. 5. Certain antidepressants. Some selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, commonly used to treat depression and anxiety, can interact with codeine and increase the risk of serotonin syndrome. 6. Antihistamines. Combining codeine with certain antihistamines, e.g. diphenhydramine, can enhance sedation and drowsiness. 7. Muscle relaxants. Codeine can increase the sedative effects of muscle relaxants, leading to excessive drowsiness and impaired motor function. 8. Medications affecting liver enzymes. Drugs that affect the activity of liver enzymes, especially CYP-D6, can alter the metabolism of codeine. Some drugs may inhibit CYP-D6, reducing codeine's conversion to active morphine, while others may induce it, potentially increasing morphine levels. 9. Medications for gastrointestinal issues. Some medications for gastrointestinal conditions, such as certain antacids and antidiarrheal drugs, can interfere with the absorption of codeine, reducing its effectiveness. 10. Herbal supplements. St. John's wort and kava kava are examples of herbal supplements that can interact with codeine and affect its metabolism.